This is a talk which I gave to the BMLA annual conference in Liverpool in May 2024, and I have no conflict of interest. So first of all, let's look at light and how it propagates through the skin. Well, if you fire laser light at the skin, then as soon as it enters the epidermis and particularly the dermis, it will scatter and the beam will spread out as it penetrates deeper into the skin. The 1/E penetration depths for the various lasers we use for hair removal are 3.1 millimeters for the alexandrite, 3.8 millimeters for the diode laser, and 9.7 millimeters for the Nd:YAG 1064 wavelength. Note that these are the 1/E penetration depths. For IPL, it's slightly different because IPL is composed of a range of wavelengths, usually 600 to 1200 for hair removal. And so this type of light penetrates according to the wavelengths and the anisotropies. So blue light will penetrate something like this at about 450 nanometers, only goes as deep as about 0.6 millimeters, which is pretty superficial. Green light will penetrate to nearly double that distance, and then yellow light a little bit deeper again. Red light at 700 nanometers will go as far as 2.6 millimeters. Again, these are the 1/E depths. 800 nanometers a little bit deeper, 900 deeper again, and then 1000 and 1100 will go to the deepest depths beyond 6.8 millimeters. Although you won't find too much dermis out there of that sort of thickness. And then what happens at 1200 nanometers is the penetration depth is reduced because of the greater absorption by water at that wavelength. So this is how, if you fired a full range of IPL light into the skin, it would spread like this due to scattering and anisotropy. And if anyone tells you that IPL energy doesn't penetrate as deeply as laser energy, then you can see that clearly they're just talking rubbish. So my colleague P.A. Torstensen did some Monte Carlo calculations to see just precisely where these fluences get to in the skin. And we can see here that for the alexandrite 755 nanometer and the YAG 1064 nanometer wavelengths, you can see that there is almost like an excess of fluence in the upper dermis and epidermis, and that's because of the high levels of backscattering at those wavelengths. Typically, for those infrared wavelengths, we're looking at a backscattering proportion of about 60%, really very, very high. For the 532 line, which is the doubled frequency YAG line, the backscattering component is about 30% or thereabouts. So what this means is that in the upper regions of the skin, epidermis and the upper dermis, the fluence is greater than the applied fluence at the surface, because of the backscattering component, the high level of backscattering component. So there's a lot more energy and fluence in that superficial region than is applied at the surface. And this leads to higher temperatures, particularly in the basal layer where there's likely to be some melanin. So you can see here within the 755 and 1064 wavelengths that the fluence is greater than the skin surface fluence, down to a depth of about just slightly less than 1.5 millimeters. But interestingly, if you look at the curves for both those wavelengths, they're almost identical all the way down to 5 millimeters. There is no great difference in penetration in reality between the alexandrite and the Nd:YAG 1064 line. The 532 line, which we use for tattoo removal, however, that's quite different. You can see that the fluence exceeds the surface fluence only down to a depth of about 0.4 millimeters, and then it drops off fairly rapidly down to just about 3 millimeters in this particular curve. So the backscattering component of the fluence, where the energy is heading back towards the surface, is significant for these wavelengths and has a huge influence on the epidermal temperatures and the upper dermal temperatures too. So let's look at the alexandrite laser. and look at what happens in the thermal nerves just below the basal layer of the epidermis. The thermal nerves obviously is where we, if they're triggered at 45 degrees, that's when we start to feel thermal pain. So this curve shows the temperature rise for an alexandrite laser at 10 joules per square centimetre in a 20 millisecond pulse. And I've looked at the skin tone along the x-axis, which is essentially concentration of melanin. It's not skin type, the Fitzpatrick numbers. That stuff is meaningless when it comes to this work, because the Fitzpatrick scale is all to do with response to ultraviolet light, and we don't use ultraviolet light for hair removal. What we should be looking at is the concentration of melanin in the skin, which I've called skin tone here. And I've used the same numbers as Fitzpatrick, since most people are familiar with that numbering scale. But these numbers, 1 to 6 here, these relate to purely to the concentration of melanin at the time of the treatment, not to the Fitzpatrick ultraviolet response. So we can see here in this instance that the pain level is triggered at quite low skin tone here. So pretty much you'll feel pain with this particular laser at this fluence and pulse. And that's because it's so strongly absorbed in melanin. Compared to the other machines, it's very strongly absorbed. But interesting point with this is that all this stuff here in the darker skin tones, this effectively represents stolen fluence, because this means that the fluence is not reaching the dermis. It's being absorbed in the epidermis, in the basal melanin, so it's not actually getting through to the dermis where the real targets are, the hair follicles and such. So this fluence is lost, so less fluence will actually reach the dermis. This kind of implies that darker skin tones require more fluence at the surface to compensate for this particular loss of fluence in the basal layer, which means then you need to, if you apply more fluence at the surface, you're going to get more temperature rise. So this is a pretty vicious circle, if you think about it, because dark skin needs more fluence. That means more pain and more potential damage. Not so good, is it? So let's look at pain. Now, interestingly, what I found here was that the pain is related to the pulse width. So if we look at skin tone 5, so it's quite dark skin, and again it's alexandrite at 10 joules per square centimetre, then what I found was that for pulse widths up to about 40 milliseconds, the temperature rise in the basal layer, and hence the thermal nerve endings, will exceed 45 degrees, which is the pain threshold. So it kind of suggests that we should be using longer pulse widths, longer than 40 milliseconds, to reduce the potential for pain. Quite an interesting result, that. So what happens when you look at skin tone 6? So the blue line is skin tone 5, the red line is skin tone 6. Dotted line here, that's the pain threshold. So we can, using pulses longer than 40 milliseconds, we can reduce the pain in skin tone 5, but not skin tone 6, because the temperature rises are very high in those in skin tone 6, because there's so much melanin in there absorbing this alexandrite wavelength very, very strongly. So it's actually difficult to cool the skin tone 6 sufficiently well to prevent pain. It's quite hard, but we'll discuss that in a wee second. So how do we cool the skin? Well, ice is the best method. Why is that? Well, if we look at the thermal conductivity of air, cryogen, water and ice at 0 degrees Celsius, we find that ice is 91 times more conductive than air, about 11 to 22 times more conductive in cryogen, and 4 times better than water. So in other words, the ice will conduct heat much better, more rapidly than the other methods, the other media. Water ice depends on the ratio of water to ice in the mixture, but it will always be better than just water on its own. So clearly, from a purely thermal conductivity viewpoint, ice is the most efficient way to cool anything, quite frankly. Even if your cryogens are at below 0, -10, -15, which some devices deliver, it's still not as efficient in terms of cooling as straightforward ice. So if we look at what sort of cooling the surface ice can do, well, if you apply the ice for 1 minute, then we can see the top curve there. You can see the temperature dropping through the depth of the skin, and at 5 millimeters depth, the temperature's dropped about 28 degrees. Whereas at if you apply the ice for 5 minutes, then the temperature drops by 20 degrees compared to the original 35 degree skin temperature. So we can see quite clearly that applying ice at the surface for longer times will have a depth effect into the skin. That's not rocket science, is it really? It's thermodynamics. So there you go. We can cool the skin significantly with ice, as you can see. And what about subsequent rewarming? Well, I looked here at cooling the surface and then the temperatures at 1, 2, 3 millimeter depths for 5 minutes using ice at the surface, and then take the ice away and the temperatures all start to rise again. Now, most of this temperature rise initially, certainly at the surface, is due to the air temperature, which I assumed to be 20 degrees Celsius. You will get heating from blood perfusion as well in the capillaries, but it takes quite a long time. It's quite surprising how long it takes for the skin to reheat, both from the air and from the blood. But the interesting thing is here. Look how cold the temperature of the surface gets to in a fairly quick time. After 2 minutes, the skin surface temperature has dropped to only 2.5 degrees Celsius. Now that is really quite important, because what this tells us is that the timing is important. You've got to apply the ice on the skin for a certain amount of time. After 2 minutes, the surface has reached 2.5 degrees, and at 1 millimeter depth, it's about 7 degrees. So the top part of the skin has become very much colder than background temperature of 35 degrees. So we can exploit this when using photothermal treatments. So if we go back to the temperature rise in various skin tones using the Alexandrite laser at 10 joules per square centimeter, well, the pain threshold is here at 45 degrees, so it's kind of a painful treatment, this. But if you pre-cool the skin with ice, then this happens. The blue curve shows you the temperature rise, because the skin is now, the thermal pain sensors are now 32.5 degrees cooler than they were previously. And that's after a 2-minute application. So we can see that the pain level now is tolerable up to a skin tone of about 4.5 or thereabouts. So reducing the surface temperature has a knock-on effect with the pain sensors, the thermal pain sensors. Drops their temperature significantly after 2 minutes, and makes the whole procedure much less painful. And this obviously applies not only for Alexandrite, but for all the wavelengths we use. So the benefits of skin cooling are obviously reduced pain, also reduced risk of blistering, because there's less likelihood of thermal damage in the basal layer, reduced risk of pigmentation disorder for the same reason, an improved clinical efficacy all around, and more consistent and predictable clinical results. So pre-skin cooling is actually really quite beneficial and important. If we apply the ice packs on the skin surface for a couple of minutes, then we get a nice deep cooling effect. The temperature near the surface is very cold, like I said, about 2 to 3 degrees or thereabouts. And then you fire in your light energy, doesn't matter if it's IPL or laser, and the heat is being generated at depth in the dermis where we want it, and the cooling effect, or the pre-cooling effect in the upper dermis and epidermis, protects everything up there, stops any sort of excess damage, etc. And what this means is that we can use higher fluences at the skin surface with impunity, because we know that the temperature up there in the upper dermis is going to be nice and cold, and higher fluences basically leads to more successful results every single time. So for pre-cooling, if you apply a higher fluence, you need to use more pre-cooling. It's a straightforward relation there. High fluences, lots of pre-cooling, and fluence leads directly to success. The higher the fluence you apply in your applications, your treatments, the more successful the outcomes are. And what this means is that basically pre-cooling with ice leads to success. It's as simple as that. It really is kind of very straightforward, this. Post-cooling is also important because if you do the calculations, you'll find that less than 10% of the light energy is actually absorbed by the targets, the blood and the hair that we're going for. To be honest, laser treatment is lousy. It's such an inefficient way to target these things. If you could start again, laser probably wouldn't be the best choice. So the problem with this is that if less than 10% of the light energy is being absorbed, then that means there's a lot of heat energy being left in the dermis, which is not doing the job that we're after. So we've got to get that energy out of the skin as quickly as possible. So normally I recommend you stick the ice packs on the skin surface for 2 minutes, take it off, you do the treatment right away, and as soon as you finish the treatment, you put the ice pack straight back on again to draw out any excess heat energy that's going to be swimming around in the dermis. So it really is all about temperature and time, just like denaturation. If you're trying to cook some protein cells in the proteins in the target cells, then you have to apply the right temperature for the right time. And the cooling, the pre and post cooling, is exactly the same. You need to apply the right cold temperatures for the right length of time to achieve the best results. It really is two sides of the same coin. So in summary, the pre-cooling protects the skin and reduces the pain sensation. Ice cooling is by far the most efficient. The pre-cooling times are determined by the skin tone and the applied fluence, and more fluence means greater success, and having a sufficient pre-cooling means you can apply more fluence. So the two go hand in hand. Thank you for listening. I will continue to do some more work on this and hopefully post up something later.